Thank you. And thanks to everybody for being here. This is a talk that can really profoundly influence your quality of life because fear of recurrence is probably the number one issue that people struggle with after a cancer diagnosis. Um, and that's not just, fear, in the curative phase of the cancer potentially coming back, but of people have a cancer diagnosis, they're in the midst of treatment, they're worried their cancer is going to get worse. So that kind of fear is probably the number one issue, along with fatigue and other problems that people often face. And it's oftentimes not addressed directly, and it's too bad because if you actually look at it and work with it, there are simple but profound things you can do to really help yourself get through the fear. Let the fear motivate you, and also let go of the unnecessary worries around this. Obviously, we're in the midst of COVID and on kind of all the uncertainties in terms of, when will the treatments get restarted? Are you at risk of a virus? So different stressors can add to the fears, and oftentimes people feel emotionally drained or upset or stressed during this time. And I'm hoping that this talk will allow you to kind of take away very practical ways to kind of lessen the anxiety, improve your immune function, improve the quality of life, and actually give you a better chance of getting through your treatments if that's the phase that you're going into. So I'm hoping this is very, very practical and helpful for you on the day-to-day. One of the things I want to say is just to kind of normalize this. It's normal to feel anxious when there are unknowns. It's normal to feel anxious when you have a cancer diagnosis. That's what we humans do. Our brains generate worries and anxieties, and that allows us to prepare for the future. And so the first thing is to say we don't have to fight against our natural reactions. We can actually use that energy, use that intelligence to motivate ourselves, to empower ourselves to make a difference, and then ultimately let go of the things you can't control and focus on the things that you can. And that ultimately will help you feel better as well. So the second thing is we want to decrease the level of anxiety, right? So if you're too stressed, too upset, there are things you can do to actually come back home to yourself and feel more clear thinking, more confident, and just essentially better, more at peace. So I want to go through some of the practical ways you can actually make yourself feel better, and then your body will be stronger for whatever you're facing in the future. And lastly, and this is the toughest part of the talk, I want to encourage people to do the deeper psychological work, and that is to look at the fears directly, because oftentimes we scare ourselves with the unknown. We don't look into it deeply enough, and therefore it remains as this kind of cloud of concern. You heard the beautiful analogy of like fear is like having a whale sitting in your living room, like just kind of lying in your living room. And if we don't talk about it, it would just be the kind of elephant in the room scenario. When you look at it very directly, that whale can shrink down. You can put it on the shelf. You can go and use it when you need it, but not let it dominate your life. So I'm going to talk about difficult issues, and the fact that you're watching this or listening to this webinar right now, hats off to you, because you actually decrease your anxiety levels by actually going there and by thinking about it, by processing it, by being clear in terms of what you can and can't do. So I really think thinking desensitizes you and makes you stronger with time. You shrink the whale in some sense when you talk about this stuff. So hats off to you guys for doing this. And the fact you're listening, also just that meta message for your psyche to your body saying, I want to recover, I want to get stronger. And so hats off for you for taking that proactive approach. Okay, so what I want to cover here, it's the, firstly, this paradox of acceptance. And then I want to be very practical about what is in your brain and how you can get this brain of yours to function best and really empower your life. Teaching the skill of setting the intention, talking about practical ways to have more calm and centeredness in your life, including reframing, which is a skill that you can learn with time in terms of how you talk to yourself and using that compassionate voice. We're going to go over some scenarios around looking at your fears directly. And I also just want to talk about a kind of transcendent perspective, something that's bigger than personality, that will decrease your fear levels just by thinking about it. Okay, so the power of acceptance. The remarkable cancer survivors, the people that do exceptionally well in their journey, the ones whose tumors shrink away much quicker than expected, or who far outlive their doctor's expectations, who undergo spontaneous remission, remarkably, they're able to accept the reality of their circumstance instead of struggling with reality and adding a whole extra layer of strife and worry and stress, saying this should not have happened, life should not be this way. They're actually able to come home as the first step and say, this is the reality of my situation. This is what I'm working with. And they start afresh. And then it's the proactivity piece, right? So it's the truth. I'm sitting here now, but I can also empower myself. And it's those two together, the acceptance piece and the proactive piece, that I want to endorse for you today. So being able to truly accept your situation, what you can and can't control, is a powerful starting point for letting go of the unnecessary fears. The second one I want to start and explain through a native North American tale, and it's of the teenage boy who approaches his grandmother. Grandmother is coming near the end of her life. She's been regarded very highly amongst the community, and he approaches her and he says, "Grandmother, how is it that you're so loving and giving and you're kind and you listen to people and you're filled with such great wisdom and people just enjoy your presence? How did you do that in your lifetime?" And the grandmother says to the boy, it was about your age when I realized that there were two wolves in my heart, the wolf of love and the wolf of fear. And depending on which wolf I fed would be the wolf that would grow within my heart. So, and obviously the wolf of love grew throughout her lifetime. And these beautiful personalities, these great people, these shining people. How did they do it? They practiced. And there's a correlate around how our brains work. And whatever you practice, your brain set down new neurocircuitry and you get better and better and better at being at that space. And so in some sense, you need to practice the loving part of the wolf. There's always going to be two wolves there, the wolf of love and the wolf of fear, but you need to practice the wolf of love. When you focus your energy and intention into whatever situation, bringing the best of yourself into that situation, you get better and better and better at doing that. And so in the midst of a cancer diagnosis, in the midst of a COVID crisis, we always have the option to bring our best selves forward, to practice being our best selves. And we're not going to be perfect at it, right? We're going to waver between feeling scared and upset and flustered and feeling more centered, calm, and clear thinking. It's going to kind of go up and down all day long. But by being conscious of it and practicing, setting down that new neurocircuitry, you get better and better and better at doing that. And so I really think that to start out with, we need to be conscious of that. And I believe in the ritual and the understanding of what I call setting your intention. What is it that you value most? How is it you want to be in this world? What is your best self? What is the highest within you that you want to manifest? And I do this in kind of three situations. One is first thing in the morning. So this morning, my wife and I had a little kind of snuggle to start out with, get a little oxytocin. And then we both went for meditation. And I do my meditation as a kind of mindfulness meditation. I'll talk about that later on in terms of how that reduces the kind of stress levels. And then I open up my hands like this and I say, guide me, help me, let me be my best self. Let me be kind, compassionate. Let me be clear thinking. Let me really help the people on the webinar today. And so I'm setting my intention. I'm being clear about how I want to be in this world. So that's a kind of a ritual that I use to set my intention as to how I want to be as a person. So that's the one thing. Now you can also do that just before you go to sleep. It will probably give you a better night's sleep. The second scenario in which I think setting an intention is very helpful, especially within this idea of being anxious and worried and stressed and upset, is especially when you're going into a difficult situation. So for instance, you're about to have that phone call with your oncologist and follow up, or you're about to have that Zoom conversation with your oncologist, or you're physically going in for your medical appointment. It's going to be stressful. It's normal for you to feel stressed. But going into that situation, you can say to yourself, I'm going to decide to be more clear thinking. I'm going to advocate for myself. I'm going to get the best care possible in a situation, right? So you're kind of boosting your confidence as you're doing that. And if we had space, I would actually get you up and do a power pose right now. I'd get you stand up. In fact, even just in your chair, you can kind of put your hands on your hip and lift up your chest a little bit. And as you kind of assume that posture, you're actually sending kind of chemicals from your body into your brain, decreasing your stress hormones, increasing your testosterone, increasing your confidence. So by simply taking that posture and setting your intention to be strong and confident and advocate for yourself, you probably get better care because you're doing that. So going into a difficult situation, like talking with, having a difficult conversation with your family member, those are the type of things where you decide, this is how I want to be in this situation. You're quite conscious and deliberate about doing that. And lastly, the setting of the intention, it's probably hardest to do, but when you're in the midst of the chaos, within the midst of the storm, and you catch yourself being totally flustered, upset, just feeling really badly, you can actually decide, I've forgotten what's most important. I forgot what is my greatest value to me. I forgot to bring my best self and see the long term here. And bring yourself back. Set your intention in that moment. Okay, I'm flustered now, but I'm going to bring myself back to calm. And that's the hardest one to do, but it's this conscious decision of bringing your best self, how you want to be in this world in every situation, and not being dependent on what other people's actions are. You decide how you want to live your life. So take that proactive choice and grow the wolf of love in your heart. And the wolf of love also stands up for oneself. The wolf of love is strong, not just loving. Okay, setting intention, super important, because part of this is deciding what can you influence, what can't you influence. That's the other thing about the remarkable cancer survivors. They let go of the things they can't control and put their attention into the things they can. Like I had a patient who said to me, I don't pray to God to be cured of my cancer. I pray to God to be given the strength to face whatever arises. And she was a young mom who I think was ultimately cured of her cancer, 20 plus years later, but she's putting her attention there. And I think when you put your attention into the kind of space of living your life at the fullest, it actually has a profound influence on the physical part of your health. Okay, so that's the first thing, is decide consciously beforehand. The second idea is that you've been blessed with this incredible brain, and you want to be able to tap into its capacity. You want to be able to ride that horse in the best way possible. And in the same way that you want to maintain your vehicle, your car, you want to maintain your brain so your brain functions at its best level. And the brain has the capacity to feel anxious. So it's normal to feel anxious. It's going to feel upset and flustered at times. This is what brains do, and we don't have to fight against that. We all have triggers, right? So you think about what could happen at that next appointment, or could my cancer come back? That's going to be a trigger that's going to give you a little bit of anxiety, and that's okay. Again, we don't have to fight against our humanness. It's just a natural thing. And then we can see this, okay, well, I'm feeling upset or flustered. Can I take practical steps? Can I learn more about my cancer diagnosis, the treatment options? Can I go to Wellspring and empower myself in those ways? Can I tap into the informational sources? How do I advocate for self? How to get the best care from the medical system? So you use that to use your logical mind to take practical steps to help yourself, right? And then ultimately, your brain goes from kind of being in an anxious state to a more centered state. You kind of flip back and forth. And I'll use the hand model of the brain. If your lower wrist is your spinal cord, then the base of your thumb would be the reptilian brain, which is really the kind of fight or flight, scared, upset, flustered part of the brain. And that has its, it has its place to kind of get you out of danger suddenly. So that's a good thing to have. So we're not saying don't be anxious and upset sometimes. Sometimes you need that energy. The next part of the brain is the thumb itself, which is the limbic system, which is the approach system, pleasure-seeking system. I call it the stressed, irritable brain because it's more kind of primitive in terms of its ideas and so on. And then through evolution, we have the last part of the brain, which is the fingers that fold over top, and that's your frontal lobe, and that's the higher executive functions. It's your capacity to be, caring, to see bigger picture, to be logical, to be social, and so on. So this is the wise and compassionate brain, and you want to have your neurocircuitry work more often out of this. And throughout the day, you kind of flip back and forth between stressed and more centered, clear thinking and caring, the best self, your best self, right? So you're flipping back and forth. And what I'm trying to teach you is to try to spend more time in your wise and compassionate brain. Okay, so how do you do that? You do that by taking care of your brain. So I think about this as creating the conditions for calm. And the idea is if you take care of your brain is more likely to be in the wise and compassionate state. It's more likely to be resilient against the slings and arrows of the world, right? So the water's more likely to fall off the duck's back when you take care of yourself in your wise and compassionate condition. So how do you do that? How do you get your brain to function better? And this is what I call like a biohack. How do you get the chemicals? How do you get the neurocircuitry of your brain to be in that best state and to be the most resilient self? The data is very clear, is to exercise. Exercise releases the happy hormones. Exercise allows your brain to remember. It allows your brain to function better. Exercise gives you motivation. It's funny, moving your core muscles and exercise actually releases chemicals to your brain that motivates you to be more social. There's incredible science now that says that exercise kind of stimulates your brain, your happier, better self by exercising. And in the midst of COVID, there's lots of different ways to do that, including putting on your favorite music, a YouTube video, or whatever, dancing in the kitchen, or lots of online classes Wellspring is offering. So exercise, number one, 30 minutes a day. The second thing is diet has a profound influence on the brain. So not only is your gut in the 100 trillion bacterial cells have an influence by releasing chemicals that go up to your brain to influence your brain's kind of neurocircuitry, but the gut has a profound influence on inflammation. And inflammation causes irritation of all the tissues, irritation of your psyche. And irritation causes fatigue. Irritation causes you to not think as clearly. So you want to have an anti-inflammatory diet, which is almost always kind of plant-based, natural type of food. So anti-inflammatory diet. And the second thing is you want your sugar levels to kind of stay within kind of a reasonable range, not getting too high. If you get like a super sugar spike, your brain doesn't work very well. And especially what happens after that is the sugar levels then crash as your cells try to normalize the blood sugar levels. And then essentially you're getting hungry and your frontal lobe turns off, your limbic system, your reward-seeking brain's going like, oh, oh, I want some sugar, and you don't think as clearly, right? So when you're hungry, you're not thinking as clearly and you're more irritable. And so it's not your best self. So the low glycemic diet means don't eat the sugary stuff, add some protein to your meals, more complex carbohydrates. That's a whole talk by itself, right, in terms of the dietary part of it. And lastly, you want to feed your brain, right, with the healthy omega-3s, the healthy fats. I'm sitting here beside some guacamole. We have flaxseed, hemp hearts for the omega-3s for breakfast. So there are non-meat ways to get the healthy fats into your system. So diet. So again, if you exercise your brain and feed your brain and sleep your brain, then you will be into your best self more often. And we can have a whole 20-minute conversation about sleep and how to facilitate a good night's sleep, which is called sleep hygiene, right? And one of the things I'll say is try to take away the stimulants, which is going to come in the next slide there. But routine is especially helpful for anxiety and difficult times. So getting up at the same time, having maybe your exercise at the same time, getting to sleep at the same time, eating at the same time. And I also believe in napping as well. Also practice a relaxation technique. Lastly, and that is the big one in my mind, is actually resetting what I call the stressometer. Like, where are you wired right now? What level of stress? If your stress level was between 0 and 100, how would you rate yourself in terms of the stressometer? And where do you carry that stressometer? What level is the stressometer all day long? What I'm going to recommend to you is you can actually decrease your stressometer, come to a more relaxed, positive, clear thinking state of mind, and live in that state of mind much more often. Now, the world is going to provide you with the same challenges. It's not like if you're in a more relaxed state, it's not going to be stressful, or you're not going to have the same decisions to make. You're just in a different space and you're able to make better decisions, is it? And so I like to practice something like a relaxation technique. So I was talking to you about meditation earlier on, right? Bringing your attention back, right? That kind of yakking mind, and you bring your attention back. You let go of the thinking, bring your attention back. Meditation, the thoughts come up, bring your attention back. This is me 20 years plus later, meditation. The thoughts are still there, but I'm not kind of buying into them as much. And when I use that muscle of bringing my attention back into the here and now, it actually strengthens the left prefrontal lobe, which is associated with positive emotions. It settles down the emotions, so you're less emotionally labile. You're more creative, more compassionate. So again, you're doing these things so that your brain is in a better space to clearly think as to what's happening, and you're less likely to get pulled off your best self. I say touch is healing as well. So if you live alone, you can still touch yourself, rub your hands. In fact, you guys can do this as I'm talking. So just like rub your forehead a little bit, rub your cheeks, rub your chin, put your hands to the back of your neck and rub the back of your neck, put your hands to your front of your neck, tap on your arms a little bit. When you touch yourself, rub the backs of each hand, rub the sides of the legs. So you're releasing oxytocin, which is decreases inflammation, allows the tissues to regain itself. And so we humans are wired to think, if I'm being touched on the skin like that, then my tribe is taking care of me, right? So touch, asking for touch, doing that hug, looking for those opportunities to connect physically has a profound influence as well on your brain. So lastly, do the things that nourish your soul, right? So you might be cooped up, but there's still ways to learn, to expand, to connect, from a social perspective, that kind of feeling connected with other people. So instead of kind of scrolling through social media, using the social media medium to connect with other people. So those are the conditions in which your brain is better able to cope and think and make good plans in the midst of the difficulties. Okay, so then I also think about, well, don't get yourself unnecessarily upset. Don't cause extra grief to yourself. And so I personally find watching the television news just too upsetting. I'm too sensitive of a person. So what I do is I listen to CBC radio to get my news updates, but I'm not seeing the sensationalized images, right? And so, it's like, don't watch horror films every day. It's not going to serve your levels of anxiety. Too much social media, right? It's like kind of flashing by, too much, scrolling through Facebook or, those type of things. Again, can kind of desensitize you. And also that feeling like, everybody else is having fun, but I'm not scenario. So again, you're just kind of creating a social comparison. And you want to avoid the other kind of stimulants that are not helpful in that circumstance. Lastly, it's an interesting idea is avoid the avoidance, right? So for instance, the whole pattern of the fear of recurrence, or generally fears getting out of hand, is when you avoid thinking about them. Or, so if you're afraid of going to the hospital and you keep canceling your hospital appointments because of it, then you're not confronting your fear, and the fear gets stronger and stronger. But if you make the appropriate decisions and go to your hospital appointment, you realize that it's not as bad as you expected, and you get stronger with time, right? So do the difficult things if it's safe and appropriate for you. So avoid the avoidance. Okay, so those set the conditions in which you're more likely to be resilient in the moment. But we humans are going to have points when we feel scared and upset and the anxiety flares. So one of the ideas is to understand what works for you. Like when you really scared, upset, and flustered, what's the technique or strategy that will get you out of this most easily, right? So have your plan, know what you're going to do beforehand, practice the techniques. And I'm going to take you through a technique whereby I let go of the kind of catastrophizing mind, the catastrophizing thoughts, and put my attention into the physicality of the body, because I'm stopping the source of the fire at its base, right? So letting go of this allows me to come home to my body, and I can actually start to regenerate the positive feelings, kind of upward spiral, by letting go of the source of the issues. The other one is, a lot of times we can talk ourselves down. We can say, well, this is not worth getting upset about. And, I've been through difficult situations before and I can do this. You just like talk yourself through it. If you can't, sometimes we're feeling so overwhelmed that we just say, okay, let's use a technique. And I'm going to take you through that breathing technique, right? In terms of 4 slow breaths and so on to kind of reset that. Interestingly, you can trick your body. It's what I call a body up technique. I talked to you about the power pose. You can also do a relaxation pose. So even right now, if you want to, you can slump backwards in your chair and kind of let your arms and your head drop downwards and pretend that you're chewing on some gum. And allow your body to relax doing that. Now, you can come back to your normal position again. What we're doing there is a body up technique. If your body is in that slouched, head down, chewing gum position, it sends a message up to your brain to say, this cannot be scary since, my body is not, on edge right now. So again, tricking yourself into a relaxation posture, relaxation response. The other one that we know is it's helpful to say, well, if I have to go to the hospital appointment and I'm quite anxious about that, imagine in your mind how you're going to feel like 2 hours after that appointment. You've come home, you've got through it, you're going to have some supper, you're going to connect with some people in your life. How am I going to feel at that point in time in the midst of supper, right? So you're imagining what it would be like to feel good again, and that can also allow the kind of stress of the moment to kind of settle itself down. And lastly, I would say, if you're in the midst of it, I think it's very helpful just to have the one wise person in your life who can just listen. And my wife and I do this actually very well together. If I've had a stressful day or something upsetting has happened to me, I'll come home and I'll say, honey, I just need to tell you what's happened. I don't want any advice from you. I don't want you to try to correct the problem. I just need you to hear me out, right? So I'm setting the culture within that moment to say, this thing happened and I felt really upset and I was scared and flustered and, I didn't know what to do. And, so I'm using, as well as I'm talking, I use the I statements. I'm claiming the emotions in that moment, say, so that they're mine and I don't have to be pointing fingers. It's all the world's fault. I can now claim those emotions and recognize that I can work with those emotions. Okay, so find that one wise person in your life who will just listen, and you can, preface that conversation with the expectation of the conversation. Okay, so I want you guys to do this with me as you're listening to this slide. Imagine that you're in that difficult, stressful situation. Like you're going to your doctor's office, you're sitting in the waiting room, something like that. And you notice that you're feeling upset and anxious. And that's a whole other mindfulness piece of what are your cues. What I want you to do now is imagine pressing the pause button on the video, right? So 99% of the time, we don't have to snatch the child from underneath the car, right? So you have some time to kind of settle yourself down. So in the midst of it, when you're saying, I don't know what the doctor's going to say, and I'm scared about the treatments and what's going to happen next, and you kind of this mind flurry is happening. Imagine just pressing the pause button in the whole situation. Next, bring your attention away from that chattering, catastrophizing mind by focusing your attention on the physicality of your body. So do that with me right now. What are the physical sensations that you're experiencing right now in your body? Watch the feelings in your gut, in the middle of your chest. Now bring your attention to your breathing. What are the sensations? Without describing it mentally, just experience the sensations of breathing. And lastly, what I want you to do is a slightly deeper breath than normal with a long, slow, smooth out breath. So breathe at whatever rate feels good for you, but really try to focus on the sensations of really slowing down the out breath. Nice, long, slow, smooth out breath. And as you're doing that, recognize that your body is actually starting to relax right now. And then you can start to reassure yourself. So the wise and compassionate part of your brain begins to engage. You've come back into your frontal lobe and you can talk to yourself, it doesn't help for me to get myself worked up right now. I can focus and I can take care of myself. And I've been through difficult situations before, right? So it's that like wise coach voice within your brain that's helping at that moment. Okay, so that's the technique, right? Press the pause button, be curious. That's what's called interoception, being curious of the physicality of your body. 4 slow breaths, settling yourself down, and then you can gauge your frontal lobe and talk yourself through it. Okay, now I like to be very practical and pragmatic, right? So just to look and understand. If you're feeling anxious and upset, what is it that's scaring me? And to have that conversation with yourself or have that conversation with a loved one or, a counselor. So what is it about that that's scaring me? So you're looking at the source of the fear. I'm scared that I'm going to get COVID if I go outside. Scared I'm going to get COVID if I, go to my doctor's office. And I don't want to get COVID because I don't want to die. So you can kind of flush that. I don't want to give that to my friends and family. I'd hate to do that as well. Right? So you're looking at the source of the fear, being clear about it. Do you need to take action, right? Somebody's yelling at you and being mean to you, then, that's going to give you a kind of stress reaction. And that would be appropriate to say, stop doing that. Or you might just have to leave the situation, right? So you're going to take action. While taking action in COVID, you're going to self-isolate as much as possible, and then put on your mask for the benefit of others and, keep your hands washed and social distance and, follow, the rules within the hospital, right? So you're taking action, the appropriate action. Sometimes a distorted belief is adding to the fear. Well, I have a cancer diagnosis. If I get COVID, they're not going to treat me, or I won't be able to have any treatment to have COVID. And so, that's an exaggeration. We're going to talk about how to reframe those exaggerations, right? It's trying to get rid of the extra unnecessary suffering. You're going to have some stress, fluster, fear. That's just normal. It's what we're trying to do is peel away the extra unnecessary and reframe that part of it. There's sometimes where the fear is going to be very difficult, and you simply have to honor the fear. And I'm going to take you through, different fears and how you might be able to just honor the underlying issue. And lastly, it's just like letting go of what you can't control, and focusing on what you can. And oftentimes, it just have to be able to see that, using your frontal lobe to override the fears that you can't influence. All right. The next thing I want to talk about is the reframing piece. And this is a technique called cognitive behavioral therapy. I like to call it reframing, essentially changing your thoughts, because oftentimes the fears are generated out of kind of virtual reality that we create for ourselves. And a lot of this stuff is malleable. That's the incredible thing about it. And this is a slide, and especially the last line, if you change the ways you think and you work with the underlying core beliefs that may be negative, you can change how you feel and see the world, and ultimately you will feel better, you have a more positive outlook, you'll be more productive, you'll be more effective in the world. So why not let go of the unnecessary core beliefs that are not helping you? Don't focus there. Put your energy into things that you can control, right? Your attitude and so on, and you'll be more effective. You'll be happier. So it's like big opportunity to reframe big picture. Okay, so you will probably see on the screen now, this is the 3-column technique based on David Byrne's book. The situation up top is just the reality, right? You're listening to this video right now is just the reality of the situation. And then you might put thoughts or judgments on top of the reality. And so in the first column under step 1, mindful of distressful thoughts, is the capacity to watch yourself think. Like capacity to, like if there's a magical computer program that could type down your thoughts 24/7, it's as if that transcript is right there in front of you and you're reading and watching your thoughts at the same time. And especially thoughts that are repetitive or that cause you more distress, those often are caused by underlying core beliefs that are not healthy, and often distorted. It's just, how that works out. So, and recognize that your thoughts about reality may be different than reality itself. We just have to have some humility to say that sometimes we don't think clearly. So if you can see that you're causing yourself extra distress by the way you're thinking about the situation, then you can work through the second column and ultimately use your kind of rational mind. And then ultimately we get to the third column, which is the kind and rational response. And you'll see that there are the 3 components of a sense of self-compassion, acknowledgement, and then seeing a bigger perspective, and then also being encouraging yourself. So easiest to take you through the examples. So the first example would be, so you're in the midst of COVID, you have a cancer diagnosis, and maybe this is a situation where the person's getting chemotherapy and they're physically tired and emotionally raw. So again, situation is just the reality, no judgments. That's what's happening. Now, on top of that, you have a thought that causes the reality to be tougher or more difficult. You think to yourself, I'm all alone. I don't have the strength to get through this. It's no use. Right? So if you talk to yourself that way, you would feel worse, right? The thoughts cause the emotional reaction. So then we go to the middle column, and you guys can type this in if you want to. What emotions follow this way of thinking? Right? If you talk to yourself that way, how would you feel? Well, depressed or despair. The body would have like a stress reaction. It's not helpful to be kind of so negative in the circumstance. It doesn't change the situation. And lastly, you start to question it like a lawyer. Is it exaggerated or irrational? I'm all alone. Well, you may live by yourself, but you can also reach out to other people. You have, connections at Wellspring. You have, the different ways that you can connect with people. I don't have the strength to get through this. Well, in this situation, we're presuming the person does have the strength. It's no use. Well, actually, they're going through their treatments for a reason, and that is to increase their chance of cure. Every time they get a chemotherapy course, they improve their chance of cure. So you can see there's an exaggeration and it's irrational. So then we go to the third column. If you recognize, oh, I'm making myself feel worse, well, how do you talk to yourself? You acknowledge, see a bigger perspective, and you're encouraging. And for this one, it's a little bit different. You've chosen a slightly different reframe, not to say this is better. I could say to myself, who says I always have to feel strong and keep it all together, right? You're putting on a brave face, you're trying to live all your chemotherapy in the next 3 minutes. Sometimes to cry or fall apart is the best thing to do. Like, just allow yourself to feel those emotions, allow them to pass through yourself. Then it seems to find an inner strength or higher power. So the idea there is that you're kind to yourself, you let yourself, and then you take practical steps. I can take a bath, or I can, I'll probably feel better tomorrow. I can do these things to help myself. Okay, so that was situation number one. Situation number two, which probably pertains to almost everybody listening now. You have a cancer diagnosis and you're self-isolating. So that's the truth. You made that decision and you have a cancer diagnosis. On top of that, you have the thought, this is BS. I'm stuck inside and can't do anything. My life is wasting away during COVID. This is totally unfair. Right? So you can see the kind of exaggerated talk, and especially if I hear myself swearing, I know that I'm giving myself a stress reaction. And it's like, you have to kind of recognize, I'm describing something that's a little bit worse than it actually is in some way. For each person, it's different, but anyways, for some way. So we go to that middle column. If you talk to yourself this way, this is totally unfair, right? This is going to anger, frustration, causes stress reaction in the body. I'm going to suggest that this is an exaggeration, is not helpful. Right? My life is wasting away. That doesn't mean you're having no life. It's totally unfair. I'm stuck. It's like an exaggeration. So how do we work with our thoughts when we're in that scenario? So we acknowledge, we see a bigger perspective, and we encourage ourselves. Again, this is the self-compassionate voice. This is frustrating, but it doesn't help to focus on the limitations. I can do things which fulfill me. This is a good chance to focus on the good things in love, right? So grow the wolf of love in your heart in the best way you can. It's not going to be ideal. It's going to be more difficult than it was 6 months ago, but you can focus on what you can control there. Okay. Situation. So you're hearing the news of the pandemic, and then you have the following thought. So the pandemic's happening, and then you think something about it. This is too much. All the stress is depleting my immune system. I'm going to get the virus. They won't treat me because I have cancer. Okay, so we already know that everyone's getting treated anyway, so it's not like there's a lack of ventilators, but what emotions follow this way of thinking, right? Again, this kind of fluster, upset, anger, despair causes your body to get weaker. Is it helpful or harmful? Yes. Exaggerated. I'm going to get the virus. They won't treat me. Yes, this is too much. Well, it's a lot, but it's not too much. You got more resilience there. And yes, there's this idea, if you allow yourself to be too stressed for too long, it's not good for your immune system, but really you can, your body is strong, it's resilient. Okay, so we acknowledge, look at bigger perspective, encourage ourselves. It makes sense that I would feel stressed. Like you say, okay, this is tough, right? This is tough. It doesn't help to catastrophize, right? I'm blowing this up and making myself feel worse. I can take care of myself and empower my body. Like you can practice these techniques that we're doing, and I can make the best of it. So again, it's this kind of encouraging, make the best of a difficult situation. Okay, for the last 5 minutes of my talk, I want to really start to look and very clearly at the fears that a lot of people experience. And I've got this through the weekend retreats, 2,000 people later, Sunday morning, asking people, what are the greatest fears? And I want to go there with you because it's important just to look at it. And I recognize this can be a very difficult topic, and I don't want to be trite in terms of thinking that there are easy solutions to any of this. But I think it's good to have that conversation and get it going and discuss it with your loved ones and contemplate it, because you can empower yourself. You can take the power out of fear by doing this. Okay, so what is your greatest fear? So some people, and it's actually remarkable, it's a very small percentage of people that would put this number one, is what would happen after kind of physical death. And yeah, so it's an unknown, but I would say that people who've had a near-death experience, and there's a lot of kind of regression analysis, suggest that something transcends our physical death. Now, that's my personal belief, and you don't necessarily have to agree with me, but I do believe that, people go to a better space in some way or form. And so you can investigate this, you can read, you talk to a spiritual counselor. So it's less of an issue for a lot of people. Okay, this is a big one. And again, if you die early and you don't get to see your grandkids get older, that is it's sad and difficult. And sometimes there's no easy solution here. And you want to be there, of course. Your family members are resilient though, right? So they have the capacity to work with whatever happens as well. We have to kind of give them their due. What I would suggest around this one is just to be able to mourn that. Say, oh, that's like, life is precious and sacred, and so therefore we really need to honor it. And if that's true, we mourn the loss in some sense, because we're all going to die at some point. And then we live our life more fully. So we really appreciate our grandkids when we see them. We really appreciate our family members. When we do those fulfilling and meaningful activities, it really brings a sense of deep connection and meaning to those things. So by looking at your fear, it actually empowers your life. You see life as more sacred and precious, and you can really appreciate it more, be more grateful. A lot of people will say, well, I'm not scared of dying. I'm scared of the process. I'm scared of what happens leading up to dying, i.e. suffering, right? I don't want to be in pain, for instance. And again, I'm not trying to minimize that that's a legitimate way to look at it. But I would say that, the palliative care teams are very good at relieving pain almost always. You might also have a advanced directive with your family to say, if I have to go to the ICU, I don't want to be resuscitated. So you're not going to kind of prolong it or put yourself through extra unnecessary suffering. And this is also a good way to connect with your family members, have that difficult conversation. Okay, medical assistance in dying. Yes, there's an opportunity to kind of bypass a lot of the suffering at the end. My personal philosophy is not to do that. But again, my dad actually went through it, and it was the right choice for him. But I think the majority of people, it's better to go through that journey of letting go of the kind of ego self and having that kind of spiritual transformation. I think that's part of the human experience, the letting go process. So I don't recommend it. The other thing that is very, very clear to me is that you're so much more resilient than you would ever know. And the reason why I say that, I've met people saying, I wouldn't want to go through that situation over there. And then I'm with them during that situation, and they're still alive, they're still connected, they're still enjoying their lives. Yes, it's difficult, but they're living, they're expressing their spirit. And then we have a good laugh about it like 2 years later type thing. So it's like, you create these fears, but the resilience matches whatever's happening. So that you are strong, you have that inherent capacity all the time, whatever's happening. The big one, I think, more than suffering, is this. Some people have the fear of loss of control, right? I don't want to be dependent on others. I'll lose my dignity. I'll feel pitied by people. Okay, I can see what you're saying, but I would say that it's like, it's a shattering of your ego state of you are the one who's in control all the time, or you're the one that's, takes care of others. And so when we can let go and realize that at some point in our life, we are going to be the dependent ones, right? And it's good to be dependent when you're a baby, and maybe in the last few months of your life, we're dependent on other people, and it connects us, right? And so we have to kind of let go, and we can grow from that spiritual letting go of our control, the kind of presumed control. So again, opportunity for transformation. Dying alone is another one that people say, and I would say it's hard to do unless you choose to do that. And the reason I say that is there are different opportunities to connect with people. And even if it's like reaching out to the Wellspring community or, family and friends, just having those conversations, expressing your fears. And so you'd be amazed at how life provides the right person at the right time to help you through difficult circumstances. And I really think the kind of support programs in Wellspring allow people to connect and support each other. It goes beyond just learning information. You're actually creating new bonds and relationships. So lots of different organizations offer that opportunity to connect with other people. So you share your concerns, and then people can step up and help you along. Okay, so last one I want to talk about is the burden on your family and friends. Again, it's this idea that they're dependent on you, and I would say your family and friends can grow from that experience. Really, from a bigger perspective, there's an opportunity for them to step up and to grow and transform with time. And this is something that we can all deal with. Okay, transcending the fear. The idea as I finish the talk is this idea that there's a spiritual perspective. It's almost like an observer consciousness that watches our lives. It's like that soul energy that is the observer. And that energy is very positive and very connected and very vibrant, full of energy. And you can be suffering psychologically and yet be at complete peace at the same time, right? And so as you do the spiritual work, more and more you'll be able to recognize the bigger energetic picture that's holding your life. And so that's a whole probably 20-minute talk as well. And just to say, go towards the transcendent approach, and that will really help you deal with the kind of day-to-day fears that we're experiencing. That's normal to experience. Those fears are always going to be there, right? We human beings are going to go through that kind of waves up and down, but we don't have to struggle as much, and just be able to be kind to oneself and to love oneself even when you're feeling stressed and upset. Okay. I want to, for the last minute here, just offer a program that we're starting this Friday, May the 15th. And even if you're starting late, you're hearing this after May the 15th, you can still join the program. It's called Mindfulness at Home. It's a free 8-week program. It's taught with Dr. Timothy Walker, who's an amazing teacher. We've done 60 plus retreats together now. It happens via Zoom conference, and we also are prescribing a daily home practice. So you're really learning the very deep and powerful skill of mindfulness that you really apply in all aspects of your life. So it's a free program. Starts at 11 a.m. Eastern time for those 8 weeks. And the great thing is that we're going to videotape the teaching part of this, and there'll be resources online and home practice. And so it's all going to be at that same website, healingandcancer.org/MAH, like mindfulness at home. So really encourage anybody who's watching this presentation to contact us. Just go to that webpage, healingandcancer.org/MAH, and you can sign up for free. And we hope to see you there as well. So thanks, guys, for your attention. I see that people actually stayed for the whole presentation, so I really, really appreciate that. And thank you to Wellspring and the amazing programs that you offer and the day-to-day, week-to-week for helping us through and empowering us in our journeys.
So thank you so much for that amazing and such an insightful presentation.